Hello, I am Dr. P.V. Bhandary. I am a psychiatrist working in Dr. A.V. Baliga Memorial Hospital. This is a initiative which we have done along with the One Good Step, a NGO which is working in Karnataka. The main aim of this initiative, this channel, is to propagate mental health. In fact, if you look at the current statistics in our country, they say almost 20% of the patients post pandemic are having psychological illnesses. So, the most common psychological illnesses are anxiety disorders, depression. In fact, 1 in 7 Indians suffer from anxiety or depression. And there are, of course, many other common psychological disorders like adjustment disorder, mixed anxiety depression, somatization disorder, dissociative disorder, schizophrenia, bipolar disorder, alcohol dependence syndrome. I'm sure you will be knowing many of these things. So, the aim of this program is to see that people take help, because there is a lot of stigma about mental health, and in fact, because of this stigma, a lot of people find it very difficult to go and seek help from a psychiatrist. They keep on postponing visiting a psychiatrist, and in fact, they wonder whether it is a psychiatric illness or something else. So, basically, let me start today in this particular program with the important questions which you can ask yourself to find out your mental health pulse. So, are you always worrying? Are you unable to concentrate because of unrecognized reasons? Are you continuously unhappy without any justification? Do you lose your temper easily and often? Are you troubled by regular insomnia? Do you have wide fluctuation in mood from depression to elation, back to depression, and that drains you off? Do you continuously dislike being with people? Are you upset if the routine of your office is disturbed? Do children consistently get on your nerves? Are you afraid without any real cause? Do you have numerous aches and pains for which no doctor can find a physical cause? So, these are certain questions if you ask yourself. In fact, I would say you should regularly tune into yourself, ask yourself these questions, find out whether something is wrong in your mental health. This becomes the first step in addressing mental health needs. In fact, to address your health needs, 4 A's are very important. The first A is awareness. This is what we are trying to create. Second A is acceptance. Third A is analysis. Fourth A is taking action. So basically, what you should understand is, if you are healthy mentally, then what happens is your social well-being becomes better. So what you should understand is, daily, how we feel, how we act, this has an impact on us and our day-to-day actions. So mental health is a major factor when we make difficult choices, when we deal with stress, and of course relate to other people in the world. So maintaining a positive mental health and treating any mental health condition, this becomes very crucial, so that we have constructive behaviors, we have constructive emotions and thoughts. So our aim is to help you to increase your productivity, enhance your self-image, and improve your relationships. So nurturing mental health, it's not just improving our daily functioning. It can help us control and also combat some of the physical problems. What you should understand is, many of the physical conditions, say heart disease, diabetes, hypertension, all these, they have a direct relationship with mental illness or mental health condition. If you are stressed, diabetes, sugars can worsen. If you are stressed, there is every chance that you can have a heart attack. If you are stressed, there is every chance that your BP goes up. So there is always a relationship between physical health and mental health. In fact, many of these diseases, we call them as psychosomatic diseases. So we are trying to discuss how to improve your mental health. So what are the simple things you can do to improve your mental health? See, first thing is seeking therapy. As I told you, accept. Many a times acceptance that you are ill becomes the first step. So accepting it, seeking therapy. The therapy is usually it is of three types. The first type is going to a psychiatrist. Psychiatrist is a medical doctor who gives you medications, and sometimes he may refer you to talk therapy. This is what in common terms we call it as talk therapy. It is basically psychotherapy. This is imparted by a clinical psychologist or a psychosocial consultant. Another thing is there are so many online support groups or self-help books. Lot of these things, reading these things or seeking help from online support groups can also make you feel better. Then of course there are so many things like journaling. In fact, many a times when you are stressed, if you write what you feel, you just keep a diary, start writing whatever you feel. That starts the first step. You start becoming better. And of course, mindfulness. Every one of you have heard this word mindfulness. In this world of multitasking, mindfulness, concentrating on the task, what you are doing. In fact, this can make a lot of difference. Of course, we may have a short video in future on this mindfulness meditation. Exercise, you will be surprised. There is a lot of relationship between physical exercise and mental health. In fact, research very clearly shows that any person who is exercising for almost 7 days a week, at least 7 hours, that is every day 1 hour of exercise can affect his mental health. He can become better. In fact, exercise releases chemicals called as endorphins, and because of this the person becomes better. So please understand this. Regular exercise and even low impact exercises, yoga, the physical part of yoga also is known to release endorphins and you feel better. And of course, the most important thing is learning to communicate effectively. Many a times what happens is improving the way we speak to others, the way we relate to others can reduce a lot of stress. Of course, there are a lot of factors which can negatively impact stress. Say post-trauma, accidents, or sometimes a sexual abuse, psychological neglect by others, and sometimes long-term stress like debts or a chronic physical illness like chronic renal failure, epilepsy, sometimes severe stress, loss of very close relative, and sometimes loneliness, bereavement, discrimination at workplace, social disadvantages. Many a times people look down upon you, maybe because of your caste, maybe because of your color, these sort of things. And of course, poverty, significant debt, being unemployed, breakup, emotional breakup of a love affair, divorce, and of course a dysfunctional family life. So these are certain things which can affect your stress negatively. Now, where to get treatment? So please understand, of course with this advent of Google, you get to know the psychiatrist nearby, and many a times what happens is you may have financial constraints. I have already explained to you about how psychiatrist is a medical doctor, clinical psychologist and psychosocial consultant. They give you psychotherapy. So when money is a constraint, you can always think of our government hospitals. Every district hospital and also every medical college, be it be government or private, there is a psychiatry department. And every taluka hospital, psychiatrist visits once a week under the National Rural Health Mission. So you can always fix an appointment and go there. And in fact, I request friends who know somebody who is having the above symptoms, please help them to get an appointment with a psychiatrist. And those of you who are disturbed, the first step is share your problem. A problem shared is problem halved, a problem kept in mind is problem doubled. So please, this is our first video. We will be meeting regularly. We will try to keep it as short as possible. Basically, our aim is to spread awareness on mental health. This is a joint initiative of A.V. Baliga Memorial Hospital and One Good Step. And if you have any questions, you can always comment in the comment box. Please press the bell button. Please subscribe our video. Please encourage us. Mind your mind. This is our channel. We will try to give you some information about mental health, but this is not a a substitute for visiting a psychiatrist. Please understand this. We will just be giving you some information. You can use this, and of course, wherever needed, please take help of a psychiatrist from your place. Thank you.